Meenakshi Chakravarti, Department of Pharmaceutics, welcome you all on behalf of Institutions Innovation Council under the initiative of Government of India's Ministry of Education of Alamut College of Pharmacy. Today we are here for a wonderful session on achieving problem solution fit and market product fit on the topic innovation, a journey for market fit on behalf of Institution Innovation Council. The theme for today's program is innovation, validation and concept development. Let's start today's program by invoking the blessings of the Almighty. I call upon Mr. Muhammad Afan from First Pharmacy to recite the Quran.
السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. أفحسبتم أنما خلقناكم عبثا وأنكم إلينا لا ترجعون فتعالى الله الملك الحق لا Allah says in the Quran, chapter number 23, verses number 115 and 116. Did you think that we were created you without any purpose and that you were not brought back to us? So exalted is Allah, the sovereign, the truth. There is no deity except Him, the Lord of the supreme throne. Jazakallah.
Thank you, Afan. I would now like to request the R&D Director and Head of Department, Pharmacognosy, Vice President, IIC, Professor Dr. Salma Khanum Ma'am to deliver the welcome address.
Good morning. A warm welcome to all for today's event organized by Institutions Innovation Council of Alamut College of Pharmacy. We are having a session on achieving problem solution fit and product market fit. I welcome the dignitaries on the dais. Today's guest speaker Dr. Srinivasan. I welcome the dignitaries on the dais. Today's guest speaker, Dr. Srinivasan, Dr. Mubin, Vice Principal, Professor and Head Quality Assurance, Dr. Preeti Karwa, Professor, HOD, Department of Pharmaceutics and Innovation Activity Coordinator. A warm welcome to all faculty members and my dear students. As we all know, Alamut College of Pharmacy has been a nurturing ground for best pharmaceutical professionals. The college is constantly seeking to upgrade the quality of its education and actively participating in research to remain on the cutting edge. This is a platform where we are encouraging students and young researchers to think out of box, to ideate and to innovate. We know our education system, especially pharmacy education system, needs to be closely linked with requirements of industry and the healthcare sector, which requires multidisciplinary approach. Ministry of Education through IAC is constantly guiding us to conduct sessions which will be useful to motivate our budding entrepreneurs. The mission of our IAC is to establish innovation and entrepreneurship ecosystem at Alamut College of Pharmacy and foster the spirit of innovation among students and young researchers. We have objectives to create positive environment for entrepreneurship opportunities. We want to nurture the startups and provide them necessary support. We want to provide support to commercialize the innovation and the sustainable ideas. We have been doing this from last, I think, more than a year to achieve all our objectives. And we have seen interest develop in the students. This is for the information of Dr. Srinivasan. We all know that I think through all these sessions now, all of you know, all of us know what is innovation, how is it different from invention, research, discovery. We know innovation is a new idea, product or method that is translated into goods or services that creates a value for which customers are willing to pay. I think that is clear. Innovation is creativity plus commercialization. And all these days we have been having innovation lectures which has taught us what is ideation, what is problem solving, what is prototyping, what is iterating and many other steps. So today we are having this talk. Sir wanted to know from students as to what are you expecting from today's talk. I'll tell you a few things. To translate the ideas and prototype into the business innovation, we need to test the readiness level, we need to test the technology transfer, we need to understand what is problem solution fit and what is product market fit. Problem solution fit is about testing the ideas and validating them, and product market fit is about market research and validation. So we want to know, we want any of you to just tell us as to when you are asked to come here for this talk, you have been informed about this. What are you expecting? Anyone? This is not my request, it is Sir's request. Anyone? Should I call out names? So then,
It's something like what they have to first understand what the market needs, like what is right now fit for what is right now fit for the market. Based on that, we will design our product or the things which we want to launch.
all of you agree with it? So, sir, I think you have some idea as to what they are expecting. So, we have conducted many sessions on various aspects of startup and entrepreneurship. Today, we are having this session on achieving the problem solution fit and market fit. So, for this session, when we were planning this session, we wanted to invite a multi-potentialite person. And we are really fortunate and honored to have one such eminent personality, Dr. Srinivasan. Sir has versatile and vast experience in pharmaceutical industry as well as in academics. And I am very sure he will make all of us understand the journey of innovation to market fit, which is his topic. We thank you, sir, for accepting our invitation. We would like to formally welcome you now with this sapling. I request Dr. Mubin to do the honors. So before I start, I want to say a few more words about Dr. Srinivasan. Sir is a mentor and avid speaker. He has developed many organizations and guided many researchers for their research, patent and startups. He has been a successful innovator. He has traveled worldwide to almost all the countries. He has contributed his knowledge and experience to many organizations, and I want to tell one more thing. He has been a guest faculty even at Al-Amin College of Pharmacy, and me and Mubin are fortunate to be his colleagues, and we have learnt a lot from him. And another thing I would want to say is, I think 1 week back when we invited him to our college, we started talking and we were talking almost for 2 hours. So I'm sure we are going to have an enlightening session today, and when Sir shares his experience, all of us are going to be motivated. So I'm looking forward to the fruitful session today. Thank you, sir.
Thank you. Thank you, ma'am. I would now request the Vice Principal and Head of Department, Convener IIC, Professor Dr. Mubin Kanu ma'am, to give us an insight on IIC Institution Innovation Council of Alamein College of Pharmacy. Ma'am, please.
Thank you, Tanushree. Good morning, everyone. A warm welcome to our speaker, Dr. Srinivasan Sir, my colleagues, and my dear students for today's session on innovation, a journey for market fit. So I just want to give you a brief introduction about IIC because some of the students are new here, first time farm, and I think fifth, seventh students are there, and even family students are there. I'll give you a brief introduction about IIC. ISC is Institution Innovation Council is a program that has been launched by Ministry of Education MOE through Ministry of Education Innovation Cell MIC in collaboration with AACP for higher educational institutions to systematically foster the culture of innovation and startup ecosystem in educational institutions. Primarily, IIC role is to engage large number of faculty, students and staff in various innovation and entrepreneurship related activities such as ideation, problem solving, prototype designing, design and critical thinking, IPR, project handling and management at pre-incubation and incubation stage. ISC of Alamein College of Pharmacy is a faculty expert student council. It was formed in February 2022 with 21 council staff members, 9 student members and 5 expert members. All the activities are carried out throughout the year in 4 quarters. We are actively involved in conducting many activities under ISC like motivation sessions by successful entrepreneurs, startup founders and by our alumni. Many sessions on entrepreneurship, innovation and workshops on IPR, prototype designing, business model canvas, funding available from angel investors and venture capitalists. And many competition for students were also conducted like making 2D and 3D models, presentation of ideas to convert from waste to wealth, hackathon and some software models, logo and slogan designing, etc. And many celebration activities as prescribed by ISC like World Cancer Day on 4th February, World Pharmacist Day on 25th September, World Earth Day on 23rd April and so on throughout the year. All the activities are conducted to encourage and motivate our young researchers, students and faculty to become innovators and entrepreneurs. ISC of Alamein College of Pharmacy was selected and sponsored by ISC, Ministry of Education to organize 2 impact lecture series, that is 4 impact lectures on themes startup and R&D and innovation, which were very beneficial to our students. Innovation ambassadors. 9 of our faculty council members have successfully completed innovation ambassador training program and have been certified as innovation ambassador by Ministry of Education. And totally we have conducted 34 activities last year, that is from the last 8 months, and secured 3 stars. And we are hoping for much better this time. We are now in the second quarter of ISC 5, that is from December to February 2023. I hope today's session by eminent speaker Dr. Srinivasan, scientific and technical advisor on the topic Innovation, a journey for market fit, will motivate our students with new ideas leading to innovation for market fit products. Thank you. Yes, sir.
Thank you, ma'am. I now call upon Head of the Department and Professor Dr. Preeti Karwa ma'am, Coordinator IIC, to introduce our esteemed guest, Dr. Srinivasan, Scientific and Technical Advisor. Ma'am, please.
Good morning, everyone. Thank you, Tanushree. I am privileged to introduce Dr. Srinivasan. Dr. Srinivasan is M.Pharm PhD with Advanced Management Diploma and Diploma in Finance and Marketing. He has accomplished profile in various talent screening programs like MAP, DISC and Gallup. He has worked on new drug delivery system, including natural products. He has number of publications in various national and international journals and several patents to his credit. Srinivasan sir has been successful in building organizations and has developed versatile experience in all-round operations of pharmaceutical organizations. He has experience of managing the organization from manufacturing to marketing, development to distribution, training to technical operations, assurance to administration of pharmaceutical formulations, human and veterinary, cosmetics and nutraceutical products. In addition, he has monitored clinical evaluation of formulations. Uniquely, he has rare distinction of working as radiopharmaceutical scientist even. Though most of the time he has been working in Bangalore, he has even worked from in Japan too. Srinivasan sir has worked in organizations like Alembic, Astra Ideal, KPL, SKF, SmithKline Beecham, Alcon, Sami Labs, Medrich and Lyras. He held positions from chemist to country head to managing director. He had academic career with JSS as visiting professor and even visiting professor at Alamein College as well as adjunct visiting faculty at Manipal. He has guided number of MPharm students. He has been a recipient of Simply Better Award from SmithKline Beecham worldwide. He has been a member of Vision Group Indian System of Medicine using Biotechnology, Government of Karnataka. He is recipient of Professional Achievement, Government of College of Pharmacy Alumni Award. He has provided his inputs even for national policies. In the recent past, he was the professor and head Drug Design and Development Center, Faculty of Pharmacy, MS Ramaiah University of Applied Sciences, and involved in review and advice on research activities of faculty, conceptualize and submit proposals to funding agencies. He also served as mentor for startups, entrepreneurs, and industrial consultancy. Till recently, he contributed as Senior Vice President Innovations, Lyras Life Sciences, followed by visiting faculty at JSS institutions. Dr. Srinivasan is active in professional contributions to MSMEs and even distance education. After such a huge career and so many achievements, still Sir is very active and working in various capacities like scientific and technical advisor and even in active in professional contribution to MSMEs. We welcome you, sir. Now stage is all yours. Thank you.
Good morning. Outside.
Don't worry. At the outset, I thank my teachers who have made me what I am today. They held my hands all across, right from the day I started to learn. Maybe you call it as ABC, but in our own language, IE. Even today, I'm in touch with my teachers and the professors who have been there with me when I was doing my doctorate also. They have been my constant source of inspiration, and every time I meet them, they ask me, what is it new you are doing? They are curious to know what is that new I am doing. Yes. This is something like somebody having a watch on me or their expectations from me to do something every time I happen to meet them. I have a lot of gratitude to them. It is the teachers who made me what I am. With this, I not of my ex, I was a colleague here. I used to be visiting professor long ago, and probably to some of you happen to know, this organization also helped me during my research for my doctoral work. I'm grateful to all those staff members, the students who were there with me those days. Saying this, you must be always wondering, okay, these guys have passed, their career is through, they're all comfortable, blah blah blah. So the problem is, what's going to happen to me tomorrow? Your first concern is, are you going to get what you want after you graduated or post-graduated from here? This question must be bugging, I think, if not all, most of you. Okay, let me tell you an incident. When I was in my mid of the career, or midlife, that's where you're a professional, you're in a good position, everything is okay. It's probably in the 80s. And during the time, that's how the information technology was the rising industry. People used to say, if you don't know software or hardware, you will be nowhere. You know that used to run perspirations through body. You're in the mid, you don't know whether to go back, go forward. I stuck to pharmaware. I'm certainly have contributed something good. I'm sure. I'm nowhere. Nobody can say I'm nowhere. I'm certainly somewhere. I'm pleasantly in a good to be proud of myself. So you're all lucky. You are in a profession where you always have an opportunity to contribute and you'll be always wanted. With this, let's talk about the interesting topic which is very, very dear to me. It's innovation, a journey for market. So, you want to be innovative. That's the reason probably you joined BIPA Otherwise, you don't be comfortably doing any other part of science. So, pharmacy is an opportunity to be innovative. Now, let's look. What is it? Normally, I have this for housekeeping to make you all comfortable. I've used some of those examples of whatever it is there, maybe available in public domain. Some of them are mine also. You can ask any question, any point of time. There is nothing like a dumb question. Just because you do not know, that does not mean everybody else knows. Feel free. Mobile phone is okay to use in silent mode because today it's the hour of the day. It's as good as you breathe. You need your mobile phone always with you. It's okay to leave the room anytime without disturbing others. If you're bored, fed up, whatever it is there, please take it easy. I've collected information, references, presentations as is applicable for this topic. In my schedule, I'll be talking something. I'll ask you a few questions. Feel free to answer. Don't be quiet. If you're quiet, you may fall asleep. That doesn't look good for me. So, respond. With those responses, I'll be able to think something new and talk. This is the agenda what I have for today. We'll start talking about innovation, its definition, why we have to innovate, what are the types and how do we do it, and what is the technology reference level, what is the tech transfer which is of so importance, which hinges around what you have invented that has to be commercialized. And there's always a thought on the problem solution fit. Problems are, it's not that there are too many problems. When you go and search for it, it may be difficult to find, or it is not the problem is not there. Problem is there, but how do we find it? If the problem is there, how do you find a solution? And how to make this product solution which can be made available to the market so that it fits the market. Finally, is it the technology only we are innovate? No. We do the innovation in the business also. Let's make a glimpse on that also. This is how I need to do that. If for some reason I have missed out something, feel free to ask. And let me confess, if I know, I'll answer you immediately. If I don't know, I'll try to find out and let you know sooner or later. So you have the freedom to ask me. Okay? Now here what it is. You must have heard these words. Jugaad, very commonly known, right? And Indians are by birth they are Jugaads. You do Jugaads every day, every time, with knowing or without knowing. Okay? There's a creativity, little sharpened up. The next is the invention, little more sophisticated. And then comes the innovation, which is the masterstroke. Of course, you have heard about discovery, which is already present, either in the human body or somewhere in the environment. If it is existing, find it, then discover. There's already something is available to you. It has some limited application. You make your efforts to make sure that the application is expanded by making it available. That's exploitation. And you want something that you are not able to see, but you somehow have got a feeling it should be available. That's exploration. People try to use these explorations, for example, to find where is a gold mine. So similarly, we try to find the medicinal plants where it has not any use. So we try to explore that. Okay? If it's already existing, and if we find that particular plant which has got an application, we call it as we have discovered the plant. This is the jugaad, a flexible approach to a problem solving that uses limited resources. You must have seen this every day on the road. Like, as I mentioned, We are all born jugards, we do it every day. The way we wear our the footwear, the way we put on the clothes. If something is working, not working, you immediately find out a fix, make it work. So that is jugad. Probably they have modernized the word called as hacking. They can hack whatever they want to do. Right. This is a creativity. Normally, this creativity is used when they can make it something more useful. So, this painting is a famous painting, which probably if you are part of this Bangalore or this is present in Mysore in the Jagannath Palace, painting by Avivarma. The greatness of what you could see as though the lady is holding a lamp which is in glow. The painting style. And this creativity is normally used in psychology, in business studies. They find a newer way of doing things, or in cognitive sciences, wherein they find out a new way. For example, if you find a new way of making a presentation, this is creative. Making cross would make you feel how it is new. Invention, probably you must have heard this word very common, as Salva mentioned. You discover or you invent a device or a composition in your formulation of pharmaceutics, or an idea or a process how to extract an active ingredient from the plant. This is all known as invention. That is, you improve from the current stage to a better stage. And then comes the innovation. From invention to innovations, when we go, it's very often it's an art. When you say art, it's not a fine art. It is a subtle nuance of doing a thing, which also may contribute the science to that, and ultimately that has to be implemented. If it is not implemented, if it is in your laboratory or if it is in your notebook, it is no innovation. Okay? In Sutix, you take your problem, you solve it, you find a solution, you do the evaluation in pharmacology, say, oh, I found out some new formula. Keeping that in the book, it's no way innovation. It has to get translated. So this is where it comes to particularly what some of you asked you, the unmet needs. Now all of a sudden, what is this unmet need? That means there is a need, that need is not met. And how do we find it? Probably, if you are used to reading the journals, very often you find the review articles. Okay? A subject of interest if you happen to see. Because first of all, you are finding a needle in a haystack. You don't know where to go. If you happen to look at the few of those reviews, and particularly instead of not taking so much time to read 15 pages, look at the conclusion summary or the abstract or the introduction. You come to know science has not yet answered those questions. Are you getting me? This becomes a clue. Similarly, in the area of your interest, there's something like there must be strong need. There's a feeling. There's a butterfly in the stomach. I want to do this. If you happen to scan that, if there are any workshops or the programs, invariably the chief guest or the keynote address person who will be talking about this, one of his intention is to make sure he addresses in a small way the unmet needs. You should be smart enough to keep your ears and eyes open to find out what is that. Did I happen to answer you? And this also happens in the workshops, and if you are keen and observant, nowadays you get day for everything there. Today is a full moon day, today is a half moon day, today is Father's Day, Mother's Day, every day. You look for those days where these types of workshops takes place. Even if you happen to see go, it's well and good. If you happen to get some of the materials from there, it gives you the area of unmet needs in a broader horizon. I'll come to you and probably go back. And The innovation goes to make it cost effective. Today, there's no point in doing an extraordinary great thing which nobody can afford. If you look at it, some of this, the American way of identifying or inventing new things, they'll keep on screening a drug to such an extent. Ultimately, it goes and finds out it is answering one particular precise treatment for cancer, which probably there may be one in a million. And to answer that, all the cost spent on that is loaded on the one in million. That doesn't make a meaning because it's too expensive for a common man to afford. Then there is a number of opportunity to keep on improving the process, which automatically reduce the cost or the comfort of making or easy available. Now, normally these are the areas at the most common level this is applied. That is how to reduce the cost. You think of something, your mind should be able to go there. How to reduce the cost? Shrink the activity time. Like in the pharmaceutical industry, probably if you know, a batch from the time you happen to get the raw material, the inventory, storing it, analyzing for microbiology for 2 weeks, 3 weeks, and then materials not available. You store the material for 3 months or 6 months. You process it for 1 month. Finished goods you keep it for another 3-4 months till it is sold. Then the problem is too long. People across, or maybe in some parts of the world, probably I can quote the example of Japan. They want the raw materials to come to their shop floor the previous day evening. They process it. The next question is asked, will they not analyze it? No. It is the liability of the ingredient supplier. If he gives the COA, certificate of analysis, it has to meet. In case if there is a goof up in the manufacturing, the product does not meet the specification, the whole cost has to be borne by the supplier who supplied the defective goods, including not only the cost of goods manufactured, the time which is involved in the factory setup to do it. So people are very concerned, they try to give you the right goods the previous day evening, the manufacturing, as soon as it is done, on the process it is analyzed and shipped. That's how they strung the cost. Now, the opportunity for improving the quality, everyone needs to have the best quality product and affordable. It's not the people they want the best quality or the lowest price, no, and affordable. They can pay for it, they're willing to pay for able to pay quality. Don't forget it. It's not like recently we got the corona vaccine from different organizations. So not now. It would have saved the life of many. Now, why these innovations you have to do? The government is forcing you, your faculty is forcing you, there's innovation cell, the company to do. You are all lucky, very, very lucky. Because when you're a student itself, you're learning to know the meaning of it. Probably we did. You are not as fortunate as you are, but you are. Why is innovation is a survival skill? What happens? There's an increasing competition. Probably you must be all aware of paracetamol. Fortunately, paracetamol is still okay. Even today it is being available. Aspirin, it was once the life saving. People used to take aspirin right from headache. It was part of the AACP. Aspirin, paracetamol, caffeine was earlier in the 1950s. The combination which is being used for almost all ailments. But when aspirin became irritant to the stomach, there was no more tolerant. It was not stable. Then aspirin life got reduced. Then came paracetamol. Paracetamol was not able to do all the activities of analgesic. It was very good antipyretic. To a very small extent, it was analgesic. So next came the COX-2 inhibitor. Okay? That's how, if you look at it, competition increases, the inventors start coming up with a new product. There are a number of examples you can go. The penicillins. Today, penicillins are no more there. Okay? Increasing globalization. Why? It's not that if you just manufacture in India and you supply to everywhere in India, it's sufficient. What happens is, when even in India people ask for very high quality, making requirement to make the statutory specification. This needs a higher level of production capacity, which is almost near to the requirements of overseas manufacturing requirement. It may be USFDA requirement, it may be TGA, it may be chemical. Because when you are thinking for exporting to other countries, your standards have to be set to that. Otherwise, with the pressure on the cost, there's a cap for Indian manufactured goods. There is a cost control. What you call it? You can also call it as a DPCO. There's a price control for any product that is used for essential goods. However, if you have to export it, make it at a better price. But then you need to meet the global regulatory requirements. Now, the consumer expectations are more. Probably I do not know, when you are young, if you go to a dispensary, people used to buy the 1000 gram jars. Some people, if the medicine is prescribed, they have to pack this medical in a small piece of paper and hand it over to you. Nowadays, people don't like that. If you give a medicine, a tablet in a piece of paper rolled up, they probably throw it out. The expectation is they want it a nice looking packaged material. It may be blister, it may be in a good container, and they need to get all the information in that pack. That's it. It's a simple example for that. Advancing technology. If you look at it, probably the earlier days when we were student days, the paracetamol, simple example, what it used to be, off-white in color. The paracetamol, only paracetamol what we had seen was the best, whitest possible one, Calpol. Trade name is Calpol. It was from Bengaluru. It was a typically extraordinary brightest white, otherwise all paracetamol must be off-white because we never cared for what all it had other excipients, colors and everything. Now, the technology gave today as an API for paracetamol, we can remove number of other impurities. We can still produce a high quality paracetamol which is white in color. In addition to that, we can also bring in those excipients which are extraordinarily good. Changing workforce demographics. Probably you know, we are all doing, probably we were young, when you had joined the job and everything, we used to work for home. We used to get committed to support the family. We used to go to work, make sure part of the salary is given to the family to run the family. Now today, the same jargon is slightly different. You work from home. Whatever you want to do, you can work from home. Probably in pharmaceutical industry, this may not be possible, except for certain areas like the regulatory functions or the auditing. You can do it from wherever you are. And in the same way, today, US FDA. Earlier, they used to come out, they say, they give you a timetable, after 6 months, they come for auditing a facility in India. Well, in advance, 6 months advance, they come and all the things cleaned up, lined up, everything. The mountains full of documents were to be made available on the tables. Now today they have changed. They can do online inspection. You may think, oh, so easy now. So there's no need of having documents, files, and everything. It has become not more difficult because every information they want it in a second. Okay, show me the document means they want you to click the mouse and show them this document. It is that means all of your activity has to be digitized. It used to be in a file, and the access to file should be such a way you should be able to retrieve that information in seconds. Please. Now, this was some of the thoughts we had. Now, let's look what happened. Earlier days, the diseases were not so many as we find. Few diseases, the doctors used to be registered medical practitioner or licensed medical practitioner. You could cure many of the diseases by giving a medicine which is either going to reduce the temperature, simple diaphragm, or a cough syrup, or any of the analgesic medicine. That's it. Antibiotics were far-fetched. Unless the coughing infection is too much, then slowly came erythromycin, or before that, penicillin came. But today's lifestyle is changed. There is age-related disease condition. People, there's a statement made. They want to see that the age itself is stopped. What they call it as no more aging. It's not you can do the facial aging of the skin can be postponed, but the biological aging keeps taking place. The body itself reacts to the circumstances, thereby it slows down. And similarly, the non-communicable diseases have increased phenomenally. Maybe the arthritis, maybe the diabetes, maybe cholesterol. You name them, they're all there. Lifestyles have contributed. People are happy. If they sit in front of a working system, they could ask for the food, drink, and everything from where they're sitting. But that leads to many of the uncommon conditions. Okay? Now, that's in general. What happened in science? Earlier days, you had a particular drug which used to happen in a particular mechanism of action. For example, most of the analgesics, the mechanism of action, those of you who still remember homeopathy, they used to say it is mediated through prostaglandins. Oh, that's become history. Now the mechanism of action is more often through the COX-2 inhibitor or to very other mechanisms. Or you go to some other. Then the mechanism of therapy has changed. The days were there when penicillin was given for everything. Penicillin had come to such an extent. It started off with penicillin plain, it's called as crystalline penicillin. Then they made sodium penicillin, which could be made into solution, like intramuscular came potassium penicillin, then came benzathine penicillin. Slowly, they're all derivatives of 6-APA, 6 amino penicillinic acids. From there, these penicillins, the whole science started becoming from parenteral route to it became orally penicillin, oral penicillin. It moved on to ampicillins, amoxicillins, amicillins. There are many things came. The mechanism of therapy started from penicillins to other antibiotics. Probably must also be knowing of. People thought there was no topical antibiotic. Then came mupirocin. Mupirocin was the first topical antibiotic. Though olden days, penicillin was used as an eye ointment. It was no more effective, but only penicillin was available as an antibiotic. But with the advent of mupirocin, it's called as a T-back now from GSK. Otherwise, it is Bactroban, and which is a topical antibiotic. Then, how the things are moved. There should be receptor theory. Probably, if you know, people were suffering from peptic ulcer. More common, The most unusual phenomenon a person used to go to doctor was is having a stomach either due to acidity or indigestion. Peptic ulcer, then people did not have any clue about it. The first generation came with cimetidine. Cimetidine was a H2 receptor blocker. We all knew histamine blocker was, which is acting on the skin areas where there should be itching or histamine like reaction. It was very big Herculean task for Smith and Friends those days to bring in cimetidine as a H2 blocker. H2 blocker was the one which used to block the acid secretion. From then, now today we are talking about prazoles, pantoprazole and various other things. They do not completely block the acid, they release it as and when it is required. That's how the therapy, receptor therapy itself got a new shift. Now today we are talking about gene therapy. People can be, for whatever reasons of the born, just born if they are able to identify there is a genetic mutation. It could be corrected by the genetic therapy. Now we all know about the stem cell regeneration, which is already in practice. And now we are looking at if there is a disease condition. From cure, they started how to prevent it, how to prevent diabetes, or how to prevent cholesterol, and all those. Now the situation is coming, can we reverse it? This is all innovations, how we are moving. If you wouldn't have moved that, would have been nowhere. Now today, if we can do the emotional mapping, why an individual behaves in a particular way at a particular point of time, by MRI, it's called as fMRI, it's by resonance imaging, by frequency. Now these are all one type of doing. Now what has happened? Thousands of years ago, we had an Ayurvedic system. People were happy, dandy, go with it. Then the modern systems of medicine came. Allopathy got a beating. But now it's coming to come back once again. Now there is a where people want to feel good about which one is better. Now there is traditional Chinese system of medicine, which has virtually gone all over the world, which has convinced the most part of the world they are superior. And it's also head on with respect to modern systems of medicine. Then now there is a herbals which are able to do an excellent job. Now you're all familiar with API, active pharmaceutical ingredient. What is API? I didn't hear. Phytopharmaceutical ingredient. This is there in, if you study forensic pharmacy, it is actually OA. Today, the government has realized, like for example, if you're able to pinpoint ingredient, herb, phytochemical, for example, curcumin. If curcumin can be identified as a phytopharmaceutical ingredient, we can go to the extent of making it 95% pure or 100% pure. We know the mechanism of action, how it works. We are able to prove it back from its therapy to the mechanism of action to various labs. So that's why it's called as a phytopharmaceutical ingredient. Now we are into nutraceuticals. The nutritional products which has got a health benefits, whether it is from the people who are taking the, you can start from the dairy products from the milk, they contribute to the lifestyle. Now, the nutrition, probably it was there, it was not given so much of importance. Very common is iron. Iron is required for making sure anemia is kept at awareness. Iron therapy, the various formats of iron therapy, right from the intravenous fluids to, you can use as a topic. Sorry, to extent of oral. Topical they tried, they're not been very successful. We don't know when it's going to happen. There was a proposal wherein iron salt of it could be given as a tape, as a transdermal patch, and made to apply so that the iron could move into the skin. They have been tried to not be successful. We don't know when it will happen. We know calcium. And we know there are many other things which can be used as a nutrition which are based on the therapy. Now enzyme-based therapy are also known. Peptide, pancreatic, all these things are used. The bile enzymes are used for improving the digestion quality. Now there's a mineral base, as I mentioned, calcium, iron, the copper. The nano copper is used as an antimicrobial. You've been using it for decades. Sorry, centuries and thousands of years at home, whether it's nano copper or nano silver. Okay? You must be saying that the ladies working in part of India, right across the world, they still continue to wear the gold or the precious metal. They contribute to the good keeping of the health. Maybe in the nano form because the gold will not dissolve immediately. It must be getting into the system in nano formats. Okay? Probably if you did not, now you know that nano silver is used as an antiseptic. It's used for wound healing. And zinc is used particularly as a topical creams. And titanium is used particularly yet to come. If once titanium is made, now it is used incorporated in the clothes. The beauty of it is, if you see the titanium in a cloth, you don't have to wash it. Just put it in the sun. Titanium has got a property to completely make it fresh. Okay? And this is being tried for other systems where titanium can be used. Okay? That gave you the room with respect to why you need an innovation to take. Probably a broad spectrum. This is not probably commonly we know. Brainstorming, any problem comes, and an individual, a group of individuals, a family, anybody will sit across, finding out as many solutions as is possible. Then you find out what is the quick right fix. You know the springboard. You're aware of it? No? I give an example of penicillin. Okay? Penicillin starts with, they're all semi-synthetic. It starts from 6 APA. Fair enough? Fair enough. Then we moved on to say penicillin, oral penicillin, injectable penicillin, sodium penicillin, gel penicillin, and then groups. From 6 APA, making a springboard, if you make 7 amino penicillinic acids, what happens? You heard of cephalosporins? So the new generation came from when penicillin was dying. Cephalosporins came. So 6 APA became the springboard for cephalosporins. Similarly, you know diclofenac? Heard of it? Diclofenac was introduced as an entry-coated tablet. When I say particularly inflammation, it was created from making it an entry-coated tablet. Diclofenac moved whether it can be used topical. Now, if you remember, if you happen to see Polini Roxogen, this sodium diclofenac, which you can apply on the skin for reducing the inflammation. Similarly, diclofenac, diethanolamine. As a pharmacy graduate, one probably for you, moment you see something, look at the name. It helps you grasp it. For this diclofenac derivative, that becomes the spring. Okay? 6 heads, you are aware of it? This is used when there are things to find out a solution to a problem. It may be creativity, it may be invention, it may be innovation. What happens in the group, the team is made an individual to wear a hat. Wear a hat means he has to take that position. There are 6 hats. One is the white hat. The white hat represents neutral. You just see what the team members are discussing. Your contribution is to find out what is right. Then comes the red hat. An individual who has been assigned this red hat is he has to come out with powerful ideas. May not be the common ones, could be anything. This red hat gives you the emotion, surprises. If somebody says, can I make an injection out of this herbal product? Have you gone mad? You're not allowed to make the statement. But he has got an opportunity to take. Okay? Then comes the black hat. When somebody, an individual who's got a black hat, he has to look at the system in such a way. Wait, you cannot do this activity because the regulation doesn't permit. The law doesn't permit. Or what you are doing is totally wrong. It is non-scientific way of doing it. Then there's the yellow hat. An individual of the team which wears the yellow hat will be looking always on the positive side. Hey, my dear friend, this herbal injection was not there so long. What happens if we drink? Let's find out what happens. We'll find the solution. Then comes the green hat. Green hat is the individual of the team which determines, hey, let's take out the best of what these guys are saying. Then comes the blue hat. The blue hat is a one. Okay, now all of you have got this. This is where moving forward, these are all the things to be done. This typically these systems are used when you are working in a workshop. A team is allowed to take one topic. The group will do all these activities and come out with a solution, which when you go on along your job or when you are put into a situation of yourself becoming an entrepreneur, you've got a thought process to do these activities so that you'll be able to come up with either identifying a problem or finding a solution. Okay? Now, another system we're doing is the focus. This is the problem. Hey guys, you're all come out with a solution. Each one will come out in 100 different ways. Then translate it to 6 hats to come out with grouping of the way or sometimes the jugaad way of playing, random. This is the problem, you do solution. I don't know. As of now, you do it. Let's see what happens. It's a random. Serendipity is the accidental way of finding a solution. Like you know, must have studied in chemistry. There's a scientist called Pollack Domack. Yes, no, all right. You heard of sulfur drugs, how they were came to life? This scientist's daughter had a skin disease. He was a chemist doing synthetic work. He was so fed up with it, he wanted to not bear the pain of the child. He said, let the child go. The child died. Because both father and the daughter could see the suffering. So he bought some material what he was doing, synthesis in the lab, applied it to it on the child's body. The child which had the skin disease, to his surprise, probably in 2-3 days, all the skin disease was healed. Then he said, what happened? What did it die? What was the chemical I did? Then gave the birth of sulfur. Sulfur drugs in its own format. It started coming to application in almost every activity. Have you heard of it? A drug, a trademark drug called bacterium, or trimethoxazole, which is metaphor, trimethoxazole, sulfur. This is all the evolution. This bacterium was invented by a Nobel laureate who was working for boring in health. This gave the biggest opportunity for sulfur. Sulfostamide could be used as other days as an item. That's how the work of sulfur scans. Called the synthetic. You also know about Alexander Fleming's penicillin, right? Now, in the modern terms of innovation, this is how it could be sustaining or disruptive. If something is not working, totally stop. Close it. Because if it is showing, you try to take it. It's no more existing. Whereas in sustaining, keep on doing something, improving. Let's look at the example. The radical innovation. I gave the example of diclofenac. From in-drink tablet, potent tablet to an immediate release tablet. From there on, it became a topical. It's also used nowadays for an injection by incorporating certain of the topical enhancing ingredient so that it can work very fast. One more example if you want to give. All of you heard about ibuprofen? Yes, sir. Good. In a second. Ibuprofen also works quite fast. Have you heard of sodium ibuprofen? Sodium ibuprofen is marketed express. The same the intention is sodium ibuprofen is fast dissolved. It's able to get into dissolution rate faster, thereby bioavailability is faster. It is particularly used for dental things. When you want instant effect. That's how the radical innovation is. Now let's look at the incremental innovation. Oral closures. There are products which comes initially as a orally useful drug, then it gets into other dosage forms, as we saw. You know, you have heard of the word called patent evergreening. That is, let's say, I gave the example of ibuprofen. Ibuprofen was used for the purpose of fast, fairly good dissolution rate. Moment ibuprofen is patent. The life of ibuprofen is almost coming to end. It is normally between 15 to 20 years. 15 years if it's for API, probably 20 years for formulation. So it's about to come to that point. The organizations can keep the same ibuprofen going by making it tweaking its molecule or making, if it's crystalline, make it amorphous, or if it's slow dissolving, you make it fast dissolving by micronizing it, making it nano, or making it salt. This is called as evergreen. However, countries like India has never supported this concept. An organization wants to keep on patent same maintained for hundreds of years, which are considered evergreen. Not or one of the biggest success was in case of the Roche patent, where India for tooth and nail not to patent. Now there is architectural innovation. Like from tablets, you can go for implants. Implants is you put this material under the skin. Particularly, the hormones are made and implanted into the skin so that they can be delivered for a period of either 7 days or 30 days. Modular innovations, now you must be very aware of this word, repurposing. Aspirin, it was a NSA. Very effective analgesic and antipyretic. When we started using the intolerable irritation, the one of its side effects was it never allowed the blood to clot. So, when this aspirin, instead of making a 250 milligram tablet, if you were to reduce the dose, maybe at 60 to 65 milligrams, and making a material which prevents blood clotting. If you observe, those people who went through with any cardio or CVS intervention, they're always allowed to or made to take aspirin, particularly the one which prevents the blood clotting. Okay? It becomes a whole new difference. Now today, there's a very big word. We all heard about the word called data analysis, data analytics. Huh? What do they do? It's okay to tell the wrong thing. We love. What do they do?
Analyze the results.
Analyze the results. What is it? Okay, go ahead.
Experimental results.
Experimental. Only experimental results. They also analyze the phase 4 results, no? They analyze the clinical results, no? Whether it's good or bad. When they do a complete mapping of a molecule, not let's go, drug is the final, a molecule. Because you know 60 to 80% of the drugs or the molecules get knocked down in the phase 1. If they take that data and start analyzing what were the good, what are the bad, what can be used, keeping that molecule, if they want to tinker the molecule, they are in a position to come out with a new one. Because of this reason, the fundamental molecules benefit is known. Right? Probably those of you who had the opportunity to study or know about structural active relationship. Good. Now, moment in a molecule, if there is a OH group, what happens? Polarity towards what is known. It also has got antimicrobial properties. Okay? If it's amide group is there, it tends to be more water soluble. And like that, if they are able to analyze it, they pick up the molecule, find out what was the untoward effect. If you either remove or modify it, you are in a position to come out with a new possible entity. That's precisely the limit. That's how people are wanted in huge numbers to do the data analysis. Because probably 15, 20, 30 years ago, this concept was never heard. All those data are probably junked and burned nowhere is available. Okay? And from that concept, if you look at, that's how you have heard about the drug called as augmentin. Huh? It's a combination of amoxicillin and clavulanic acid. The clavulanic acid came from one of those molecules which had the opportunity to what does clavulanic acid do? It's a beta lactamase inhibitor. All microbes tend to produce beta lactamase. And thereby, if you give only amoxicillin amongst the beta lactamase program, amoxicillin becomes useful. When you put chloric acid to go and destroy the beta lactamase producing enzyme, then amoxicillin is in full swing to do its antibiotic. This is how the examples what you got for please. Now, the main purpose or no, they call it as a key. What's the key for this innovation is? It's the observation. If develop this, what do you call it? It's a very small thing. Keep observing. If you develop the aptitude and the attitude in your lab experiments and whatever you do, this observation, it phenomenally contributes to the skill to innovate. Am I making a clearly understandable statement? Yes, no? Did you hear me? Yes. Now, what? Look at this. If your intensity of observation is too intense, there's an experiment going on. You want to see all the activities of the experiment. In the seriousness of looking at it, you know every step involved. What's happening? The change in color, change in the physical format. Like for example, when you are studying a solute and a solvent in a beaker, in a known volume of both. If you are keen on observing what happens, the first stroke of movement, the second stroke, by the time you come to 10, if it is a solution, you will see it at some point in time. But if you go a step ahead to see, feel the beaker, you'll also tend to notice whether it's an exothermic reaction or endothermic reaction. If you see while you're studying, if the solute molecules are only getting spread, partially dissolved, we'll come to know whether it is partially soluble. And similarly, when you're doing it, there will be change in the color sometimes. It may be clear, transparent. Two, may be change in the color due to the reaction with the solvent or other dissolved substance. That gives you what is that you want to look for, and what is in your research you're looking for. That is the intensity of your observation. Why you want to do that? If you've got an investigative mind, I want to find out in my experiment what's happening to the end result. There you get a acute or a strong intensity of observation. Similarly, I did this experiment in chemistry lab or I did the experiment in different lab because today we know there is a contribution of volatile material. If some of you had an opportunity of using gas chromatograph, and if you are injecting, particularly when you want to detect other volatile impurities, OBI, organic impurities, if a substance or happen to be somebody in the lab is working with other solvents, doing some extraction, whatever it is there. In this process, if you're injecting, in addition to what you inject, for looking for OBI, there is a possibility of those external solvents getting into the system. So you get a peak which you have not there. Like you use a solvent OBI. The solvents you never use in the extraction. This is one of the major industrial problems. The final sample has got a OBI, but you are not using the solvent. From where it has come, it's an investigation. Now, similarly, how we find out methodical way of identifying the observations which gives us a tangible results. You're all aware of this? Great. Can we move to the next one or shall I? Okay. Copying someone else's idea. We do it. Most of the industries copy somebody's formula. This happens in generic form. A company makes paracetamol tablet, 10 companies make it. Okay? Like that. Ask customers what they want. Now, like earlier they were just only designer clothing or designer jewelry. Now today we are making designer pharmaceuticals. You heard of the 3D concepts? In the 3D, you can design the dose and the drug which is required for that particular individual. If you ask a customer what he wants, you can deliver that precise quantity. Now, observe customers. Probably in earlier days, when pediatric syrups or the dose were given, you could look at the face of the child and say, your product is palatable or not. Right? If the child is to make an obnoxious face, you know your product got a horrible face. Right? Even today, if you make them take from taking the cholesterol, it is no more attractive. But of course, even now, the cod liver oil and the shark liver oil is fed to the children to get the omega-3 fatty acids. If this cod liver oil is not palatable, you can see the reaction in the child, not only the child, but you can see the adults also. It gives information for you to improve the taste or the smell of the product. You get complaints. If you got a customer care, you get at so and so or call number so and so. Whether they take it or answer it or not, you don't know. But most of these products have got it. This used to be a very good information, particularly. Companies have this product for acne. Resorcinol was used as the most common acne cream nature. Subsequently, the other benzoyl peroxide they all came. People in the lab thought it's an excellent, extraordinary cure for pimples. This was a big product. This acne care or acne cure came. When they got this, the faces became red due to the burning. When the customer started writing or responding to them saying that, hey, wait, your product is strong. No, clear cell. Clear cell was a big product, but it had resources. It used to burn the skin. And they used to claim in 7 days all people are out. The product itself was not able to stand that. Similarly, they changed out to benzoyl peroxide, it had the same problem. The customer, when they hear this feedback, they had to stop the problem till they find something else, the product will not be launched. This is the complaint or the difficulty with it. You got an opportunity to innovate or substitute something. Then combine. A good example was with respect to amoxicillin with chlorinic acid. What amoxicillin? So this will make you remember about it. Then you had paracetamol in combination with ibuprofen. Right? Imol. Ibuprofen. How these products came into big success is because of they combined. They thought what could be of more use. Eliminate. If you got the olden days, you had aspirin, penicillin, caffeine. Then they said caffeine is not permitted because it's a stimulant and it also increases acidity. They removed, they kept only aspirin and penicillin. Then penicillin was an issue, then they replaced aspirin and paracetamol. It could not also sustain because aspirin and paracetamol forms effective mixture. Now today there is aspirin is alone and paracetamol is okay. Then ask your staff. If somebody is in the lab who has done the experiment who knows what is incompatible, what is not good, what to be added, where. Okay. Then you ask to find out the unmet needs, you plan. You put a big questionnaire with respect to what you are looking for. Circulate it with hundreds of people to give answer. From there, there is opportunity for you to identify unmet need. This is planning. Brainstorms at home. You do it very often, either alone with a group of friends or with today shall we go to this club, to the restaurant, or to the restaurant. Examine patterns. Probably now that you are young and fresh, if you start reading a pattern which is published, probably if you happen to read about 15 to 20 patterns, you get the hang, or you get the feel of what can be patterned. How to go about innovating. What is the small little things, the things to do? That leads you to an expertise in doing it. Then collaborate. If that's good in delivery system, but you don't know how to test it, go to chemistry or go to the pharmacology experts who can evaluate it. Minimize or maximize. This I think everybody must be knowing. Yes, no? You know paracetamol? Huh? Yes. What is the dose of paracetamol? 500 mg. 500 mg. What is the per day dose of paracetamol? It's 2 grams. Okay. Paracetamol has this analysis. Smartly, the Panadol, the original name given by Stanley, they came out with 650 milligrams sustained release 3 times a day for osteoarthritis. Once every 8 hours. It's pattern. Okay? Did you listen to me? Did you hear me clearly? 650 into 3 comes to the maximum dose of paracetamol per day. That's how easy to remember two grams. This 650 happens to be pretty comfortable. The original research of Panadol to get a best therapeutic effect of paracetamol is not 500. It is between 650 and 850 if it is taken per day. It gives a substantially good analgesic effect. However, 650 sustained release Panadol is there, restored like this. So, the smart guys, our neighbor, micro, they came up with 650 milligrams IR tablet. There is a publication, well justified clinical trials of Panadol. It can be justified, there is nothing wrong. 650 is a better dose than 500. So they include it to make it a 650. Similarly, you got amoxicillin. Amoxicillin earlier was 250 milligram capsule. You can go up to 500 milligram capsule. In fact, the dose of amoxicillin you can use 1 gram per day. And that is a sustained release or even in 1 gram if you give, probably in 3 hours, 80% of amoxicillin is thrown in the urine. So, but amoxicillin still can be given as 1 gram. So, from 250 it became 500. 250 4 times a day became 500 twice a day. Morning 1, evening 1. Now, how to minimize it? Is an example good enough for your maximizing? Minimize? Very good. Aspirin, the conditions are there. Aspirin as analgesic is 250. Aspirin for the most serious treatment is 65. Minimize. No? Right here. Your heart of micronizing. Microfined aspirin. Aspirin is done. Now, have you heard about micronized albendazole? Why albendazole is micronized? Albendazole is it systematic drug or a topical? You call it a systemic drug just because it's swallowed the tablet. What is albendazole used for? And so it is not systemic. Systemic means what? It gets absorbed in the system, gets into the blood, goes to different parts. What is albendazole fermenting, absorbed, and then goes into the blood? Then it is topical. Topical where? Topical in GI. So if it is topical in GI, if the particles are micronized, it gets very large surface area. It can do a better and therapeutic job. Okay. Now, I gave earlier slide talking about for nutrition to use some material like copper, silver, what they are using. You heard about nanoparticle? Silver there it is used for a hand wash or it's coming in soap used for as nano silver. Okay. What is nano? You reduce the particle size to sub-microns. Okay? Right? That is minimizing and maximizing. Okay? Thereby, that's innovation, right? Because earlier there used to be a tablet of the silver complex used for discharge. It's a gold tablet. for reasons of its durability. Another context, probably you must be aware of it. Very often it is used for TV serials. What happens next? If you answer that, you will get a car or a bungalow, whatever it is there. You come out with your contact, depending upon that. Similarly, if in an organization of creative people, there, in R&D, these contests are thrown open to give best solution. Ask what if this material is done ABCD? You get some answers. If you got a question, if you're not understood it, ask. Raise your hands and answer. You're clear with respect to that? Then, what's the competition? Everybody is looking at whether this company is going to come out this product. Are they good in antibiotics? In industry, what happened? Till probably 20 years ago, the research had almost come to stop still in pharma. Probably the 70s, late 60s, and early 80s were called as a golden era of pharmaceutical research. So many molecules came, so many receptor theories came, so many new drugs for new ailments came. Subsequently, it started reducing. People went on to do that. If I know the chemistry, modify the chemistry, I get a new drug. All those drugs, like COX-2 inhibitors, they did very little bit of improvement, nothing extraordinary. So when the drug research came to a almost low target, the biotechnology industry came up in a big way. That's how semi-synthetic penicillins shot up, syphilis was shot up. Then vaccines came up. For anything you ask for it, there was a biosimilars came. Okay? That is, if you watch the competition, you know what's happening. Sometimes, like a big company, big MNCs, they don't have, what do you call them? They have become banker. Banker with ideas, every day they are listening to something. The new thinking process does not happen. The process improvement they cannot do. What you must have heard? Low license manufacturing, contract manufacturing, contract researching. When they outsource it, they are able to get some little bit of improvement. Most of the packaging development, most of it, was the innovation of this contract manufacturing. Because they could try it out with the small resources, they came out with the new technology. Probably when you were young, you could have seen a huge blister pack, 10 capsules so big. Today, get 10 capsules in a small scale. There is also a modification of the innovation by this contract manufacturing. They came up with the cylinders which could be very closely at this web. Okay. Use open innovation. This is done by software hacking. Hackathons, you heard them? It's kept open for everybody to come up with a set. These organizers will pick up the best idea. Okay? Unfortunately, we don't have hackathons for pharma industries yet. Okay? Adopt a product to a new use. This is what we call as a repurposing.
Pharma industry. We have for that, developing a course for healthcare, hackathons.
Okay.
We did a competition.
Great.
One of the students was.
It's excellent. Like that. You heard this? This means what? This is a word used for small little improvement. One step at a time. Like I gave the example, ibuprofen, sodium. Ibuprofen can also be made as an injection using a non-aqueous route. Diclofenac is an excellent example. Diclofenac, sodium, diclofenac, diethylamine, like that. The mother of all these things is penicillin. Penicillin, you can go to a wide range of things. That's how they People did not want to work this. Did it. Go back in time. It's how they did it last time. Have heard of the story of thalidomide? You have heard, but you don't know. Thalidomide is a classic example with respect to untoward effect producing ah, this, the infant was born with disfigured body part, but that was how to stop. However, thalidomide was repurposed to find out its anti-carcinogenic properties. It is used as an anti-cancer drug in a specific case of cancer. Because it's not of wide use, small use, it is very well repurposed. And use ask 100 people what is the solution for it, including the grant. They will tell you once upon a time they were trying to use it, see whether you can use that the herb or that practice to be kind of combination. That's how many of these herbal cough syrups came into market. Which they were very successful. All said and done. Now coming back to this, I'll pick up you as a person who asked the question. Now we have an unmet. How to find an unmet need? I gave you a few examples. Normally, you do this, take this problem and do the brainstorming. And say brain, you can do it alone. Have this problem set in the head. And then the second part is equally important. Walk comfortable pace to long distance without a check. Switch off your mobile, switch off your contacts, everything. Your only mind is you want the solution to the problem. Keep walking. The mind knows you're walking. You walk in a place where you don't have to wish anybody. Unknown. Preferably in a time where there is no disturbance. Very often, this is very, very, very often. I do it. That's the reason I'm telling you. Keep this working in the head. You don't probably even have half an hour, 45 minutes, 1 hour, 2 hours, whatever it is. The mind, is a volcano. It keeps on trying to automate. Some point of time when you go through, hey, there is probable break. It may not be the exact fit, but you are there. With that, you are able to write down your brainstorm and then probably jot down this most probable. Next day you can come and refine. And get this as many ideas, record your ideas, write and speak, good, half an hour, 45 minutes. This becomes as a hobby to you. You will be in a position to resolve umpteen number of problems and issues. Maybe you know, maybe you don't. Maybe what you studied in the past will answer you, or you can search. Do you have any questions up to this? Perfect? Or it's full of confusion. Any feedback? No? It's okay? Was it okay? With your permission, I can go forward. Please. Anything I need to know? Huh? Shall I continue? Okay. Now, this we are going for its application. This is what we said, technology readiness level. This is a measure. You evaluate where you are standing. Because this is what an outsider wants to know. I am at TRL level 1, 2, 3, or 7, whatever it is there. If you say, you are in a position to make an announcement, or the other person will be in a position to come and meet up with you, talk to you, take it forward. Are you clear with this technology readiness level? It is your experimentations of what you have done. Maybe it's too small, I'm not very sure if all of you will are in a position to read it or see it. For the comfort level, let me read it. What you do in your M.Pharm or the final year, depending on the project, you go look to the journals, refer, collect the data. Let me call it as a scientific review of the knowledge which is available. This TRL you can divide it into two, the research part and the development part. The research part is the first one, wherein the information which is available in the public domain. Then you may need to, from there, with that information, you jot down what can be done. Still a hypothesis. What can be done? What is the possible ways of doing it? This also can be evaluated, analyzed with other experts. This is information available in review article. Can this review article, what they say, unmet information, can it be done? Or it's still ad hoc? Or do we have the capacity or capability to do it here or somewhere? Then, this so far is up to this point is your on paper. Nowadays, the beauty and advantage is everything is available in the internet. You Google the information, you get it. Or you can ask them. Some of your friends abroad, they can tell you. Because it's up to paper. Then, the next step is you identify from this information what is the unmet, what can be done. That information could be an ideal molecule, or maybe a natural product, or maybe a phytochemical, maybe an extract, whatever it is. It is still doable on a bench scale. After you get this, you may have to try this, do this extracting, take say alcohol, water, whatever it is you get. From here, you will do the animal experiment, or microbiology, or a chemical experiment. This experiment still will be non-GLP. GLP is good laboratory practice, or you can do it on your laboratory, it's non-GMP. You are not bothered about microbiology. Then, with this, getting the results from animal studies or microbiology or whatever, then you can just move on to doing a demonstration of it, higher quantity. Make sure it works from one animal model. There's a levels of doing animal model. You start from the rodents, you go to the primates, you have to go for the animals which are live or dead from their tissue level system level. Then you come to your more or less the formulations what you are doing in the laboratory. Or sometimes you got only the extract. You don't want to do any formulations point of time. Put them in a capsule. Feed it to a live animal. Find out its observe all its food. They still up to this point is a research. You only know the probable action of that extract or a chemical or whatever. Very often those people who in M.Pharm, they do the research in chemistry. They identify some particular molecule, either they try to do the microbiology or whatever it is. They stop at the time when the time is good. If you're a doctor level, take it further. You come to your point. If you're in aesthetics, you see whether you are able to design a novel dosage form from it and test it on an animal model to see whether it works. Or if you're lucky enough, you still have to go ahead to do a proof of concept in a limited number of humans. Clinical trial. By the time, if you are aware, if you are maybe the doctor level, if you're good, you got a good NDDS, Norwood Design System, you're confident, you try to make this dosage form in a good environment, GMP environment, either reverse or go to somebody's site, request them to do it, use those excipients and those all inputs which are pharmacopoeial grade. You have met the specification. If you go to a company, the practices they give you, make use, do it in that facility. The environment is good, microbial friendly. This dosage, do both in vivo, in animal model, or do it in a limited clinical trial. That means when you are covered up to this GLP, that you are talking about, you come to a very, very good level, and the fifth level. If it works good for you, then you are in a position to take from higher. This is what you call it. When you do this activity, first you are trying to do it in the pain scale. That is the table complexing. It's all normally 1,000 of the production scale back. For example, if your tablet is going to be 1 lakh grams, you are trying to do the first level of 100 grams. If you're good, results are very encouraging. You move it to the from bench scale to lab scale. It is 100 from 100 to 1,000 grams. 1,000. Then you do the pilot. That also you all from there on you're all doing the GLP GLP studies. From 1,000 you move to 10,000. This is almost not the balance. If you're very happy, very successful, then you do 3 validation batches on a regular basis of 1. At that stage, you have come to this product. Let's say 1 lakh is your commercial batch. Commercial batch is ready. That is the one which takes you to the level 7 and 8. Because you are at probably at level 7 and 8, you are still doing from at probably 5. If you are lucky, between the 5th and 6th, you are going for phase 1. Limited number of human trials, normal human. Then you go for 2, where there is a targeted disease state or where you got an ailment that you are testing at a higher level. From there on, you are going to the next step. This is where either the 5th or the 6th day you start submitting the data to the regulator for IND. Innovative new drug application. Then, second, after the phase 2, you do for NDA. From NDA to you go additional new drug data, ANDA. Then you supply the full dossier to get your. Normally they give the limited permission for commercializing. Though they say normal limited control, this means you know the distribution, you know where drugs will be able to track. This is technically a pharmacovigilance. Or phase 4 will come in to track if there any side effects were there, anti-details were there. All these details are monitored and collated and available for scrutiny by authorities. More often than this, most of us will do it in environment. Right? Very few take it to this. Right? If you are a repurposing way, probably you are somewhere good. Because your limitation is there, you are not moving on to GLP. However, probably if you got a program in such a way your MPharm and PhDs are almost together, between these stages, if you got a collaboration, this is where you can take the your industrial. That means to say, if that is your goal, from here on, you must be very, very clear. There is an opportunity, not here. At this case, get a patent. You can get a provisional patent. If you are able to do this provisional patent within 1 year, it is going for patent. You have got an opportunity to do a proof of concept. If you are able to have a good understanding, and if you do that, your patent, the proof of concept is saleable with. And if here you can have your partner, industry partner come in, either you can say, have it, you can give it to him to take it forward. Because you got a limitation. Beyond this, you cannot. This up to this stage, you have your fertile ground. You can do what you want. Are you okay? Am I clear? This is the opportunity. See why sometimes there used to be asked in what way Indians are can be great compared to USA. Among the big differences in USA is they have got an affordability to one's work buying a most expensive equipment to everything. Okay? Here, they got a huge opportunity with huge number of technically qualified people to do. If it takes 2 years to come out with something up to this stage, probably with all our combined resources, we can do it in 2.5 years. Am I talking something? Zero? Don't ever underestimate yourself. Do. You need a doable effort. You need at this stage to select the right thing to do. At every stage of your plan, you can be an innovator. You can be part of the plan. I've seen it in my own. I have my students who did right in MS Ramaya. Number of guys who did in M4 by the time they have thesis. The only thing is they cannot publish. Unless the provisional patent is filed, they can publish. That's fine. When the examiner comes, they can see this is patent. This is the provisional patent number. Examiners are too happy to award the maximum number of marks. So keep this opportunity open. Any questions? No, I think something you are not very clear. Yeah? You have doubt, you have question to ask. Come on. No? That's clear? I think probably, and this is what many startup industries, many people who have put up the industry have looking forward to this huge resource coming up from this type of institution. Okay? They're open, they're looking for simple things like, okay, when you're started, you know the drug is safe. It's a choice. Okay? Don't take a first time synthesis molecule, no. Non-molecule, independent drug delivery system, you can do that, then you got a proof of concept, hey, I'm ready. They'll come to you in a I can guarantee you. Okay, please. Next. Are you clear with this? Technology? Huh? The level. If you know the level, you should be interested to see how can I go to the next level. I gave you the inputs hints. If these things can be deliberated in a group where you can take an individual activity and then spread it out. Now, the same thing how it happens in an entrepreneurial activity. How do they come from? Commercializing. This we saw, okay? Different types of innovations what we saw. And this we, how where all we can apply this innovations to. And this is where. Okay? Now, here where comes the market entry, competence and capability. How quickly you want to enter and how it is assessed. The person, a businessman who is in the business, he is smart enough, he knows how to introduce the product. He has got sufficient resource, manpower, money, everything, how he can put the product into market. Because of this pressure, he may not be very happy with respect to the level 1, 2, 3, 4. He does not, for him it becomes best of it. what is your most important is his wisdom. If you are able to give it to him, you get love. Okay? This from here on, that's the reason when I told you make a provisional patent is with respect to that one, the protection. You protect what you have invented. You need a mentor for it. How to do that? It's doable. Then, either in the protection, either you patent or if you're very confident, bring in that partner. Hey, come on, I've done it. Once in a provisional statement, once your name comes as an innovator, anybody who buys your patent, the inventor's name cannot be erased. Okay? As long as that becomes, you still contributed to that invention. Yeah? So giving off to some other company does not mean you lost everything. You still hold your name appears in the book of the patent. In addition to that, any modification improvement you do, 1, 2, 3, first name is there. 4, 5, 5 additional names can be there. 1, 2, 3 cannot be removed. You got your valuation, you got your the right. Okay? Then, because of funding and everything, he will be able to, if he knows, here is your skill of marketing, your how you have applied your knowledge to come to that. Then, after that is done, this is my limit. If your partner is there, you can start, can continue to your doing your development improvement in that GLP facility. Because from this stage, it's not tomorrow morning launch. Still takes about 3-4 years to complete. You can still continue to be associated with your product, with your project in his company as an employee. You getting me? If you are good and smart and doing it, your employability, you need not have to write your application. Please give me a job. He will give you a job without your application. Okay? That's what it is. Then comes the development. Okay. No, I gave you the example of brain scale, pilot scale, those scales. Then deployment is how it is marketed. Today you can do it by e-marketing or through this contacts, by promotion, going visiting the doctors, these things. That's it. This table is with respect to the whole activity with respect to the innovation to distribution. Okay? With your permission, let me cover. I will probably take about 10 minutes. Is it okay? I expected because I thought I'll reduce the number of examples.
Very interesting.
That's nice.
We had 2 sessions.
True. That's the thought. But without my control, I started giving many examples. Probably please forgive me. Okay? The technology of course is where from your lab scale or whatever you invented, you are able to take it to the large scale. That is, your technology should be able to be transferred to a largest exploitable scale which can be available in commercial. That's called technology. This, why it happens is sometimes the research and development is in-house. Still, from your lab, somebody has to take it to your production. Sometimes you do the research here, production will be somewhere. Sometimes for reasons of economics, you do it in one company. For example, there is excise benefit in Himachal Pradesh. From Karnataka, you have to transfer the product to there. The technology transfer also takes place because of what all the areas it involves. If you look at quality assurance, if you look at the arrows, it goes up and down. There's always a communication between technology transfer and training, back and forth, back and forth. The reason for that is all the technology what has been developed by the R&D, by the analysis of the QC and the packaging and the production department have to have the well clarified documents. This standard operating procedure should be able to be used by other site or the production site of that area. Similarly, there is an up and down type technology transfer between engineering and department. This engineering department has to make sure that the equipment is okay. Whether from 100 tablets you can take into 100, whether 100,000 or 1 million. The 10 lakh tablets you have to produce it. Whether the suitability of technology is there, the speed is there, the materials is there, equipment. Whether the equipments are able to withstand your material. The aspirin is corrosive. 5-aminosalicylate 5 years is corrosive. By the time you run the current would have had a hole. Okay? Similarly, other departments, the research, formulation development, analytic development, they validate. Make sure the batches are reproducible. These batches formulation along with QA, when they go to the production, they have to ensure at least 3 batches are reproducible. Okay? That whether it is 100,000 or 1 million. Because R&D will start making notes of what is the difficult. For you, take 5 grams we add. There you are going to add 5 grams. You cannot do like this. For 50 kg, you cannot do it. What is the equipment you need to transfer? Here, when you do that, you may be doing sifting in 1 second. You have to put it in equipment to see that. What all other materials are. So, manufacturing find out their equipment is capable of doing this product, the product characteristics, materials, and everything. Similarly, the QC will make sure from analytical development they will be able to validate it method. It could be pharmaceutical method, could be in-house. They will keep on doing it to make sure, and right from the raw materials to in process to finished product to the packaging. The QC department because they have to be signed off. Similarly, the packaging material will ensure the product is for you when you did 100, you are not bothered. You just put it into the one. Then you have to make sure whether the equipment, whether the tablet size moves in a tube or not. That this is the crux. Many companies have got this becomes a bottleneck. They cannot transfer the technology. Ideal example is augmented becomes very difficult to produce and enhance. It needs terrible control of humidity and temperature. It has to be at 80 degrees centigrade, temperature at 18%, relative. Otherwise, it is the moisture will react with chlorinic acid because it is potassium chlorinic acid. You know, chemistry, pharmacy, potassium salts are more hygroscopic than sodium sulfate. Okay. Remember, we saw in the technology really very TRL level is almost like the preclinical phase, in the clinical phase, the post These are all the activities you do. That is process development, how do you do the sequencing, how do you find out what is the best method to do that. Then nowadays it is very important to do the EHS. EHS is environment, health, and safety. Most of the Indian organizations are not capable to come to the standards. Simply put, if you are making a product X, if it is hazardous, you cannot start the next product unless the whole environment is totally clean. Operators are not exposed to chemicals. Okay? I'm skipping this. Probably will come to this, probably at the end of it, maybe interesting. What is this problem solution fit? We have found out the unmet means somebody wants an anti-diabetic. Whether if there are hundreds and hundreds of companies who are making it, Is my product will also be saleable? Am I giving that kind of product which makes a meaning? That is where you call it the problem solution fit. Today, if you go to the Ayurvedic products, herbal products, they give you powder. So they call it as churna. How do you swallow it? Very difficult. Or just because if you write natural product tablet, natural product made tablet, if it picks up some moisture, if it does not disintegrate, maybe for your QA can take a lot of natural products and do the DT testing. Many of them will not pass the DT. Often in fun in industry we should not recycle the tablet. It will never disintegrate just because the moisture tightens in such a way you cannot disintegrate. Probably this trifluoride tablet is there, it will not disintegrate. Very, very difficult. Because when it is dry, the moment you put it, it absorbs the moisture. This moisture is sufficient for it to become very, very, very hard. It is something like sugar-based chewable tablet. It will not disintegrate these things. After knowing the solution, then you come to know, you validate this problem. Is it really diabetes plus what? Or what stage you want? You want a type 1, type 2, insulin resistant, insulin non-resistant? Which one you want to give? Is it type 2 or post type 2? There's a pediatric diabetes at that. When you come to all these things, this validation, you about your customer profile, whom you are giving. If you don't know this, you will never meet the problems. This is the profile. Check with them to make sure that he's really wanting it. Not that you decide. Just because my grandfather gave me 100 acres of land, I grow amla. Amla is the product you take it, whether you like it. Develop a solution for his problem. He wants for this reason, this is not only me. He wants across the people. Then do the, this is what are the surveys. Market survey, first step. This is where precisely identifying solution. This becomes your probably the technology that in level 1. Then you can move on. So this is solving it, identify the problem, define it. Come up with a possible solution. You got it? Not proof of concept is there, it works. Make sure it comes. Find out forward delivery systems you can give. What are the options? In which format you take? The nutraceutical, aerobic drug, pharma drug, or you're going to give your delivery system. Chewable, candy, chewing gum, capsule, yes, solution. Implement it, evaluate it. Then comes your problem solution should be able to really satisfy. You know, guys, many products fail in the phase 1. Phase 2 is because you know there's a problem. You had a solution, but unfortunately the solution is not fitting into the market because we got too much of reward on the reservation. You may not be surprised. Today in the market, we have got so many products, at least 30 to 40 products whose bioavailability is very, very poor, ranging between 5 to 25% only, including atorvastatin. Atorvastatin, the bioavailability is fast, it's only 10%. It's prescribed left and center. So there's a 10 milligram tab. If 10% is bioavailable, what is the efficiency? So if you come out with a solution of high bioavailability, 1 milligram salt, it's a big problem. Okay? That's how you find the unmet need. This is true for toxicity. If you learn about, there are 30 of them, I had identified my colleagues. Then this is when you identify. You know, if I say that if I give you atorvastatin, only 1 milligram, no side effects, from 80 to 90% bioavailability. Will you take it? Everybody will be happy. You know that. The 9 milligram what will be excess is having the nephrotoxin. You are going to get it. Okay? Now, the product might be fixed. What is the validation? If you observe, test the plus. This is what agencies do. First, they will find out the product vision. I want to have a solution for type 2 diabetes. Who's got so much of cholesterol, so much of diabetes, very simple. I'm going to come to him. He is classified as metabolism. This customer, who are all the persons who will go to benefit? Probably those who are in the range of 45 plus. Population around the world is so much. Simple. You will make sure that they go to the surveys, demographic data, various health population data. This will confirm that. This hypothesis, if I give this type of product, then they need it buy. Everybody buys because everybody wants to live 100 years. Isn't it? But at 45, you are getting into this issue. Okay, it doesn't matter. After 45, I swallow this tablet breakfast. No. One domain. Make sure that I have no. This product will make sure that control the blood sugar, cholesterol, bones have obesity. Liposomes are meant for this. Liposomes are meant. Like, if I make this product, if I spend $1 billion, we'll be able to recover this $1 billion in 1 year, 2 years, 3 years, 4 years, 5 years. Measure them. Moreover, which country is the one which needs maximum? Yes, okay. All these countries where prescription is written and they get a reimbursement. So, in the starting itself, the product is priced at $100. The cost of manufacturing is $10. Right now, $50. The one said, hey, tomorrow morning, 24 hours left. Because you don't know by that time, you don't know, somebody already would have done bad. The last one I would like to take is in the business. The profit model is how to make money. All these days, pharma industries used to have a wholesaler, CMF agent, in the retail or in the stock. Now it's cut. Straight away people can sell to the retailer or to the online. Okay? Where the money is. When you are saving 30% of marketing distribution cost, network. This network connection for all the distributors, for all the retailers, is applied excellently for grocery. They know they move the goods to the retailer every day he needs his thing. The goods are moved in that. Before end of structure according process the material in such a way. Your delivery system is excellent. Every day morning the truck comes and delivers by the time you open the door. Make sure your product performance is functional. It is working for anti-diabetic. It's not just water tablets you want. Make sure you are making it widely. Maybe tablet, capsule, injection, transdermal, what all you can do so that nobody, not even looks at it in the lens. It could have covered it. That's called system. That means you are going to pencil. Give an extraordinary support with respect to product. No market companies, no shortages, no regulatory issues. It goes on. Then इससे अच्छा डिस्ट्रीब्यूशन क्या बना मेक श्योर योर प्रोडक्ट इज ब्रांड you have such a brand you take the brand name not the chemical one you say cross it Dolo people remember as Dolo not as acid the brand they engage the customer by giving constantly ringing. Thank you, thank you, thank you.
Thank you, sir. It was great. I expect the students to maintain some decorum. I know it's lunchtime. We don't get people like sir every day. It's very difficult to arrange people like sir, those people who are so busy, so enthralled with knowledge. So please show some respect towards your college and towards sir. At this age, if he can sustain hunger for half an hour, I think you can do so. Thank you, sir. It was a great session wherein you started the session by thanking your teachers, which portrays how humble and great a personality you are. Today, we are really overwhelmed with your session because till now, whatever sessions we had on innovations and things, we did not have any pharma related examples. This time we had pharma related real examples wherein we could learn that yes, these innovations are possible in pharma, and that was a great thing. I would like to thank you wholeheartedly with all my students and all the faculty sitting here. Thank you so much, sir. I will now request the dignitaries and Preeti ma'am, Mubin ma'am and Salma ma'am to honor our guest and felicitate Dr. Srinivasan sir. Thank you, one and all. I will now request Ms. Kavana, Assistant Professor, Department of Pharmacology, to deliver the vote of thanks.
A very good afternoon to one and all present over here. On behalf of Institution Innovation Council of Alamein College of Pharmacy, I, Ms. Kavana, Assistant Professor, Department of Pharmacology, take this privilege to propose vote of thanks to all those who have contributed in successful execution of today's session. First, I thank Almighty God for making today's session a memorable success. I would like to thank Dr. Mohammad Salahuddin, Principal, President, IIC of Alamein College of Pharmacy, for his encouragement in conducting today's session. Thank you, sir, in his absence. I extend my heartfelt gratitude for today's speaker, Dr. Srinivasan, Scientific and Technical Advisor, who honored this session with his informative thoughts about innovation. I thank Dr. Mubin Ghani, Vice Principal and Convener of IIC, for providing constant support in arranging this session. Thank you, ma'am. I And I thank Dr. Salma Khanum, Vice President IIC, Director R&G Cell of Alamein College of Pharmacy for her guidance towards the event. Thank you, ma'am. And I'd like to extend my sincere thanks to Dr. Preeti Karwa, Coordinator IIC and Head of the Department Pharmaceutics, and all the members of the committee and all the teaching faculties and non-teaching faculties for their cooperation in successful conduct of today's session. Thank you all. And I thank all my dear students who were actively participated in today's session. Thank you.
Thank you, Kavana. That's the end of the session for today. Students, please be seated until the guests go out of the room.